Hey, it's Chris Dyer.
Chris Bowman.
Brad Johnson here.
Hi, Brad.
Hi, guys.
Bottom line Thursday. What do we have
Oh,
today, Brett?
The
I mean,
survey.
you really can't see this, but it must be Blue Shirt Thursday.
It is. I
Oh,
think
I
so.
just noticed this.
if you had to guess what I'm wearing, it's probably going to be blue.
9 times out of
Me
10 for
too.
me too.
Me too.
I only own two shirts, and the other's in the wash,
Yeah, we know.
and
We
they're
know.
both blue.
But they look good.
I don't know
So,
about that.
yeah,
Yeah, it's all I
quality
can do
versus
this
quantity.
old face. All right. So, mental health in the
Oh, yeah.
workplace. Should we talk about it? That's
It's a
Yes.
what
big
the
one.
survey found. So, Employee Benefit Research Institute, legit, nonpartisan outfit for geeks like us in the benefit world. They surveyed employees, like over 3,100 employees.
Okay.
They basically asked, have you accessed mental health benefits, you or anyone in your family? And 27% said they or someone in their family did over the
Man,
past year for mental health conditions. So, to no surprise.
that is
Um,
shockingly high.
well, what's interesting is they found the survey thinks it's underreported because then they went on in their survey to ask, did you visit any providers that
Mhm.
were psychiatrists, psychologists, that type of thing? And even if the person said no, no one in their family did, they did have a person in their family visit a mental health provider. So I think the stigma
Wow.
is
Yeah.
keeping people, and we all know on
Agreed.
surveys, I think
Yep.
we maybe hold a lot close to the vest. And so I think that was true. But, the most common conditions, to no surprise, anxiety, depression, ADHD. I think it's
Huh.
Hmm.
more frequently diagnosed now. And so that was out there. But what they found though, okay, so they identified how many people have these conditions that they're struggling with. But what's the toughest part about it? To no surprise, access to care.
Man.
Absolutely.
Insurance carrier challenges, even just things like time off work and childcare. They can't go visit a
Hmm.
provider during work
Totally.
hours. And a lot of times, those providers, at least locally, are often 8 to 5.
Right.
Yes.
Unless you want to go ER, which folks with mental health issues are more likely to use ER, which makes sense if they're really having a
That's what's
challenge.
open. Yeah.
No one's open, they got to go there. And that's just more of a
Yeah.
stabilization thing, which is too bad. So, anyhow, I know you guys had some good thoughts on that with the virtual care being kind of a growing
Yeah.
trend. So I'm going to stop there and let you guys start chatting.
I know we've seen higher mental health claims on our self-funded health plans, and it's all of them have EAPs, which we know are underutilized. And we've heard the same thing. It's not that I don't want to use it, it's I can't get in to see a provider in rural America that's taking patients in adequate time. We've got clients that are in this space as behavioral health treatment centers, and they're overloaded. I think access is definitely a challenge, but a lot going to the virtual care.
Yeah. It's a
Yeah.
problem. There's, as we all know, many vendors out there. Please do not DM us, because we don't want to talk to you. That that have great solutions, yet they're
Yes.
very expensive. It's hard to get past that cost, where you're looking at a PEPM, and then they have better access. At least you hope they have better access because they have
Yeah.
more providers in their network versus our carrier networks. I mean, there's a lot of solutions. I think it's just trying to find the right one. But it's, as Buyer
Yeah.
said, we have a client that their mental health spend has literally tripled in the last 4 years. It's
Yeah.
real money. It's hundreds of
And
thousands a
it's
year.
not, and for several, it's not just visits, it's inpatient care because somebody is at that spot where they didn't have intervention soon enough. And,
Good point.
you're seeing that happen too. So, you know, I think that's another area that we didn't talk about in years past was inpatient behavioral health. It was
Yes.
just maybe you talk to a psychologist, maybe you talk to a counselor,
Right.
and there's some significant conditions that we're seeing. So yeah, I mean that echoes what we're hearing from our clients and from employees that we're talking to is they need access and they're getting more comfortable to ask for help.
Yeah. I don't know if it's in our lifetimes we'll see the stigma go away, unfortunately, but I'm glad it seems to be lessening the
Yes.
stigma of
Yes.
getting help. And we all know people that have been firsthand affected by this and hope they get the care they
Yeah.
need. So, yeah, just kind of a sign of the times with what this is showing. So, no
Totally agree.
Yeah.
surprise.
Thank you, Brad, as
Thank you,
always.
Brad.
All
Appreciate it.
right. See you
We'll see
next
you.
time.
All
All
right, bye
right.
bye.
Thanks, guys.
See ya.